Work with a group of scientists who perform viral genome sequencing, and we've been doing this for other viruses for a while now, but since March of last year, we shifted focus to COVID, and we've been sequencing SARS-CoV-2 since the start of the pandemic. We have sequenced and deposited thousands of samples so far. These are samples that come to us for testing for SARS-CoV-2 that turn up positive, and then they come to our lab, and then we sequence the genome of the virus in those samples. A test tells you whether or not you have that virus in your sample, in your swab that's come out of your nose. Now, sequencing tells you a little bit more about the virus in that sample. So what we are determining is the exact sequence of the approximately 30,000 letters that make up the genome of this virus, that have all the instructions for the little bits of the virus that tell it what to do. The Delta variant, this is another one of these variants of interest or variants of concern that we want to track closely. It has been shown to be associated with increased transmissibility. In the UK, it's actually overtaken the Alpha variant, the B.1.1.7, and so it's something that we're really concerned about, and we're watching those numbers over time. So I think the important thing to remember is that the vaccines are really good, and the vaccines are very effective at preventing severe disease, regardless of which variant a person is infected with. They are very effective at reducing the probability of developing very severe disease and being hospitalized with COVID. But definitely the different variants do have different sensitivities to the antibody response that's generated, right? So with some variants, there is reduced neutralization by our immune response, or that's been developed by vaccination. So this variant appears to be one of those. And so what we need to remember is that the most important thing is to reduce the number of cases so that we reduce the probability of being infected with any, or being exposed to any variant, not just a specific one.